Dear students, today we are going to learn about a drug which is the first line drug in the treatment of amoebic liver abscess and trichomoniasis. This drug is also useful in the treatment of many anaerobic organisms like Giardia lamblia, trichomonas, and many anaerobic bacteria. So the drug is metronidazole. So metronidazole is the prototype nitroimidazole. It was introduced in 1959 for the treatment of trichomoniasis. Later on, it was found to be a very effective anti-amoebic drug. And it is also having broad spectrum cidal activity against anaerobic protozoa. Even it is effective against anaerobic bacteria. Coming to the spectrum of metronidazole, it is effective against anaerobic protozoa like Trichomonas vaginalis, which causes trichomoniasis, Entamoeba histolytica, which causes amoebiasis and even amoebic liver abscess, Giardia lamblia, which can cause giardiasis. It is also effective against anaerobic and microaerophilic bacteria, which include Bacteroides fragilis, Fusobacterium, Clostridia, Campylobacter jejuni, causing gastroenteritis, anaerobic streptococci, Helicobacter pylori, which is notorious for causing peptic ulcer, spirochetes. Many of the anaerobic spirochetes and Fusobacterium, they cause many dental infections. So metronidazole is effective in the treatment of many diseases caused by these anaerobic and microaerophilic bacteria. Coming to the mechanism of action of metronidazole. Metronidazole, we told that it is a nitroimidazole. So it has a nitro group which is reduced by redox proteins which are present in the anaerobes. This is important because only the anaerobic organisms have this redox proteins which help in the reduction of the nitro group in metronidazole, causing the activation. That is why this drug is specifically useful against anaerobes. So, firstly, the nitro group is reduced by the redox proteins present in the anaerobes. And it forms a cytotoxic nitro radical. And this nitro radical will act as an electron sink, which will compete with the biological electron acceptors of the anaerobes. And there will be disruption of the energy metabolism of anaerobes. In the anaerobes, the pyruvate ferredoxin oxidoreductase enzyme pathway will produce electrons. And these electrons are taken up by certain biological electron acceptors present in the anaerobes. And thus they have their energy metabolism. So what metronidazole does is the activated nitro radical of metronidazole will compete with these electron acceptors and therefore disrupt the energy metabolism of anaerobes. So why metronidazole does not affect the aerobes? The aerobes does not have the redox proteins So the reductive activation of metronidazole will not occur. Also, the oxygen competes with the cytotoxic nitroradical for the electrons. So it is ineffective in case of aerobic organisms. There are some other actions of metronidazole which contribute to its cytotoxic action. It inhibits cell-mediated immunity. It induces mutagenesis and cause radiosensitization. These are some other actions of metronidazole. Pharmacokinetics of metronidazole. Metronidazole is completely absorbed from the intestine. It is widely distributed in the body. The metabolism occurs in the liver by oxidation and glucuronide conjugation, and there is renal excretion finally. The plasma T-half is 8 hours. So we usually give metronidazole 3 times daily. Adverse effects of metronidazole. They are usually frequent but unpleasant, but they are not so serious. You can see that most of the adverse effects are anorexia, nausea, metallic taste, abdominal cramps, and loose stools. They are unpleasant side effects, but not so serious side effects. So the common side effects include anorexia, nausea, metallic taste, abdominal cramps, and loose stools. It can also cause headache, glossitis, and dryness of mouth. In some allergic patients, it can cause fixed drug eruptions. And if the patient develops fixed drug eruption, the drug should be discontinued. This is an image of fixed drug eruptions in certain patients, which can be caused by metronidazole. In long-term use, it can cause peripheral neuropathy. So the adverse effects of metronidazole include anorexia, nausea, metallic taste, abdominal cramps, and loose stools, which are common side effects, headache, glossitis, dryness of mouth, fixed drug eruptions in allergic patients, and on long-term use, it can cause peripheral neuropathy. Contraindications of metronidazole include blood dyscrasias, any neurological disorders. Metronidazole should not be prescribed in patients with history of neurological disorders. It is also contraindicated in pregnancy, first trimester, because of the risk of mutagenesis. It is better to avoid metronidazole during pregnancy. So the contraindications are blood dyscrasias, neurological disorders, and first trimester of pregnancy. There are some drug interactions with metronidazole. It has a disulfiram-like reaction with alcohol. So in alcoholics, if we give metronidazole, they may develop some disulfiram-like reaction. That is, patient may have dizziness, respiratory problems, hypotension, sweating like symptoms. And enzyme inducers may reduce the effect of metronidazole. Metronidazole can enhance the action of warfarin by inhibiting metabolism of warfarin. Coming to the uses of metronidazole, it is the first line drug in amoebiasis. There are several dosages which are given, and common recommended doses are: in mild intestinal disease, the dose is 400 milligram 3 times daily for 5 to 7 days. In case of invasive dysentery and liver abscess, we give a higher dose, 800 milligram 3 times daily for 7 to 10 days. If it is very severe cases, we need to give parenteral metronidazole, 500 milligram intravenous, slowly every 6 to 8 hours for 7 to 10 days. One thing we should keep in mind is that metronidazole is less effective in eradicating the cyst of amoeba present in the colon. So we should combine them with luminal amebicide. Second use is in giardiasis caused by Giardia lamblia. The dose is 400 milligram 3 times daily for 7 days. In Trichomonas vaginitis, metronidazole is the drug of choice. The dosage used is either a 2 gram single dose, or you can give 400 milligram 3 times daily for 7 days. Important thing to remember is, if the case is recurring, we should treat the male partners and also may require intravaginal treatment if it is refractory cases. Metronidazole is used in guinea worm infestation. We can use 400 milligram 3 times daily for 7 days. It is used in anaerobic bacterial infections, and in mild cases, usual doses 400 to 800 milligram 3 times daily. In severe cases, which may occur after colorectal or pelvic surgeries, we may require IV infusion until the oral doses can be given to the patient. And it is prophylactically used in gastrointestinal surgery. In gastrointestinal surgery, there is contamination risk with anaerobic organisms. So we can prescribe metronidazole prophylactically in patients undergoing gastrointestinal surgery. It is also used in the treatment of pseudomembranous enterocolitis caused by Clostridium difficile. This is a super infection occurring usually due to the use of broad spectrum antibiotics. There will be overgrowth of pathogenic flora as the normal commensal flora will be destroyed by the antimicrobials used. And this can cause, one of the common example is pseudomembranous enterocolitis caused by Clostridium difficile. The treatment for this condition is oral metronidazole, 400 to 800 milligram 3 times daily for 10 to 14 days. Another drug used in this treatment is vancomycin, but because of its toxicity, it is less preferred. So metronidazole is usually the drug used in Clostridium difficile causing pseudomembranous enterocolitis. Metronidazole is the drug of choice in acute necrotizing ulcerative gingivitis or trench mouth, which is a condition caused by anaerobic bacteria like Fusobacterium and Streptococci and spirochetes. So metronidazole can kill this Fusobacteria and spirochete complex, thus reduce the symptoms caused by trench mouth. Usual dosage is 200 to 400 milligram 3 times daily for 5 days, and it is usually combined with amoxicillin. In case of H. pylori gastritis, metronidazole is used in the triple drug eradication regime for H. pylori, where metronidazole or its congener tinidazole is combined with amoxicillin and a proton pump inhibitor for 2 weeks. The dosage of metronidazole is 400 milligram 3 times daily. Nowadays, H. pylori is becoming resistant to metronidazole. The congeners of metronidazole are tinidazole, secnidazole, ornidazole, and cetranidazole. Most of them have longer duration of action and they are better tolerated. So to conclude, metronidazole is effective against anaerobic microorganisms, especially the anaerobic protozoa like Entamoeba histolytica, Trichomonas, Giardia, and also against anaerobic bacteria, which include Fusobacteria, Streptococci, Spirochetes, Campylobacter, Helicobacter pylori, and Clostridia. So metronidazole is the drug of choice in treatment of amoebiasis, Trichomonas vaginitis, acute necrotizing ulcerative gingivitis or trench mouth, which is occurring due to Fusobacteria and Spirochetes, pseudomembranous enterocolitis caused by Clostridium difficile. There are some adverse reactions of metronidazole, which include mainly GI gastrointestinal side effects like nausea, metallic taste, abdominal cramps, and loose stools. Only on long-term use, it may cause peripheral neuropathy, and fixed drug eruptions, if appears in a patient, we should stop metronidazole. Thank you.